So this is an introductory video to try and explain what some of the resources are in DICET. DICET is the DeBakey Institute for Cardiovascular Education and Training, and there are numerous resources from which industry can actually cherry pick what they require in order to build a course. So here we are up on the second floor of the Research Institute. It is outside our 250-seat John Bookout Auditorium. There's a nice space that will typically set up booths, and it's an opportunity for industry to present their various different products in this area. It can also be an area where we serve food and drinks. There are also two large screens where we can relay the program out of the Bookout Auditorium so that those vendors who are outside can actually see what is going on and the presentations which are taking place. And here's a picture of Mr. Bookout himself. So this area can handle about 250 people. Now we've moved inside the auditorium. It is a very nice auditorium. It is completely integrated into our operating rooms and into Mighty, so that if there are cases which we want to demonstrate, it can be relayed in. And this is all controlled from a very large control room situated in the back of the auditorium. And this is overflow seating, more stadium style at the back, which allows us to bring this up to about a 250 capacity. So a variety of different meetings are actually held here. This is a view now from the speakers end, looking back up into this banked auditorium. Large screens, multiple different screens can be brought in and hosted here if need be. Now we're moving from here into the immediately adjacent to this is another overflow area. We refer to this as the Research Institute boardroom, but this also doubles as a approximately 70-seat, slightly smaller venue. Again, this can also be used either for serving food, or we often line this with additional booths for vendors, depending upon the size of the show which we're running on that particular day. This is also integrated fully from an audiovisual standpoint into operating rooms, cath labs, and up into the operating rooms and labs that were up in Mighty. So cases which are ongoing can be relatively easily transmitted and seamlessly. This is because of the integration. It's really just a matter of push of a button, and we can actually witness the procedures that are being done either in the building or in the adjacent hospital. So from here, we're going to move up into the fifth floor of the Research Institute. And this is where main Mighty is actually held. And now we're actually moved up into this. On a plaque on the wall is our namesake, Dr. DeBakey, and all of the educational activities in the Heart Center roll through what we refer to as the DeBakey Institute for Cardiovascular Education. The hands-on or the skills workshops for DICET are predominantly held up in Mighty, and the acronym Mighty stands for Methodist Institute for Technology, Innovation and Education. We're very proud of this. Many training centers around the country are in a dismal basement. Here you can see this beautiful space. It's in the heart of the medical center, and we think of this as mission control. This is called a med presence room, and this is a very nice 35-seat auditorium, which again is connected both back into the training labs in the fifth floor itself, but also can connect into the hybrid operating rooms, the main operating rooms, and even more remotely. As we walk down the front hall in Mighty, there are a number of different classrooms, and these can be configured in a variety of different ways. And so the whole concept of this is that you pre-flight, in other words, train our educators and students beforehand, then they go back and do the procedure, and then you debrief back in these classrooms. So you need to have enough classrooms in order to support this. And you can see there are screens at either end. A room this size can be completely partitioned down the middle to make two smaller rooms. And it's very nice from an industry standpoint. If they've got customers who are working back in the hands-on space, they can actually see and observe what they are doing. So what we've now gone is back into the main training facility in Mighty itself. This is, as you can see, this is a huge auditorium where multiple surgical or nursing teams can actually work. And again, it can either be one large space or each of these can be partitioned. One of the really nice features of this is that in each of the modules there is a training area where we can transmit images to the various different other stations. It's also supported by a CAT scanner. This is a GE 4-slice CT scanner. We use this really to create images, often for image fusion. Immediately adjacent to this is the Intuitive Surgical Training Center. This is by and large used almost on a daily basis. Intuitive essentially run this and bring in general surgeons, gynecologists, and this is a fairly busy place, but this is also available to support, for example, minimally invasive cardiac surgery programs, and we will bring experts in to train people from around the country using the robot for takedown of the lima, for example, or a robotic coronary artery bypass. We've now moved into what we refer to as the hybrid room space, and this is a combined MRI / Zygo hybrid room. We also have a Symbionics simulator. We can do patient-specific simulation here. But as we move back into the main bay, this is a fully functional Siemens Zygo hybrid room. And this is all preclinical. We don't bring patients in here. And you can see in the background is transesophageal echo. We have a Bluetooth ultrasound. All of this is supported by Storz integration. So everything in here is recordable and transmittable. And behind that silver door is the MRI scanner, which allows us to evaluate using MR the efficacy of any intervention which we perform. And you can see this is a beautiful space, very like the hybrid operating rooms that we function in on a daily basis. That is a Visitor 1 robot from Siemens that allows us to, it can be remotely controlled for remote proctoring, remote visualization. And this is the Hansen Magellan robotic catheter control system. As I say, this doubles both as a research lab and as a training lab. And we're particularly interested in the integration of 3D visualization and 3D imaging. And one of the nice features is that that table, not this particular table, but the table can be disconnected, that door can be opened, the patient can be moved straight into the MRI scan. And one of the areas of great interest in the Heart Center is MR-guided interventions. We really see this as an opportunity in the future. So the entire area is often supported by industry, and these are just an example of some of the partners who support this. What we're particularly excited about is immediately adjacent to Mighty. This is where the North Campus, this is going to be a new Heart and Vascular Center. And so one of the real advantages of the DISET setup is the immediate adjacency of the large clinical operation and the ability to move seamlessly between case observation, performing cases, and straight into this training environment. It makes it very nice both for our participants and our educators. Thank you very much indeed for the opportunity to tell you a little bit about DISET and some of our programs. Thank you.